Hi, Dr. Todd Snyder here. And in this 6th episode on smile design, we'll be evaluating 1 to 2 magnification photographs of retracted smiles with more macro aesthetic and tissue focus. Now, we talked about global view already, where we addressed excessive gingival tissues. We're now looking more closely at the tissues and the teeth with this image. So gingival zeniths should be slightly off-center on the central incisor by about 1 millimeter. The lateral incisors, it should be off about 0.5 millimeter from the long axis of the tooth. And the canines, well, they should have the gingival zenith right on their midline. Now, the gingival zenith is tied into the angulation of the tooth. So we're still evaluating angulation and how it influences the appearance of the gum tissues. And while I'm looking at the tissues, I'm wanting them to be symmetric to match the opposite side of the mouth with no variations in height or width. So I'm looking to make sure that we have symmetry both in height and angulation and zenith position, as well as the actual contour of the tooth, right? So we don't want any variations in height or width. Now, I'm also looking at all the teeth back into the molars and comparing it to how much of the gum tissue shows on display when smiling. And so if we have an irregularity because of lip position, we want to point that out and then decide if we need to address it or not. Now, the next thing I look at is the pupillas to make sure there are no differences between them, as they too should be symmetric to their counterpart on the opposite side of the mouth. So we'll notice here that we have symmetric tissues. Here we have symmetric tissues. And so we're trying to make sure we don't have a bulk excess or deficiency. Now, in looking at the interproximal contacts between the teeth, the contacts move more apical as we extend posteriorly from the midline. And now that sometimes is going to cause the papillas to be slightly shorter as you move towards the back of the mouth. But papillas should also be the same symmetry in width in the front of the mouth as far as to the adjacent teeth, but also they're going to be slightly wider in the front and potentially getting narrower in the back because you're seeing less of them. Okay? So we don't want things too broad, we don't want things too small. Potentially they're going to get narrower because you're seeing less of them. Now, the next thing I want to focus on is the incisal embrasures. You'll notice them here. Now, notice they get progressively wider as we move from the midline distally. Now, this progression is important as well as the size, because if they're too small, the teeth are going to look artificial like piano keys. And if they're too wide, well, then the teeth start to look a little peculiar because there's lots of spaces in between them. So again, these are progressively going to get larger. Tissues oftentimes are going to get progressively smaller as we're seeing less of it as we move distally. Stay tuned for the next episode on Smile Design Tips, where we'll be discussing microaesthetics.